I feel like it makes allied health clinicians a lot more respectable within their roles. Being able to have these conversations with other members of the MDT, being able to have conversations with neurologists, consultants, rehab clinicians, patients and their families, um, and really kind of become a bit more involved in like a team care plan rather than kind of working in silos. Um, and it really helps advocate um, for plenty of decisions, whether that's discharge planning, um, goals within the community, NDIS planning, anything like that. I think it just really supports a lot of the decisions that we make as allied health clinicians. And if I could prioritize my sessions and make it best for the patient and for the organization that I work for, then why wouldn't I do that by using brain imaging?
Yeah.
Um, and so I feel like a lot of people sometimes also have a lot of unanswered questions for why something's not working during a treatment session. And then they get kind of stuck and they, try all these different things. But I think if ultimately kind of go back to the images and search as to what might be the cause of what's happening or what can make something a bit easier if you knew what was happening within the imaging that it usually tells you. And I think that can solve a lot of questions that come up um, within any sort of allied health team, whether somebody might be having like a neglect versus like a visual impairment, or if it's cognition related. I think a lot of times those overlap. Um, and there's lots of discussions within our um, MDT about, oh, I actually think it's neglect. Oh, I actually think it's, a hemianopia. Oh, I think it's this. And I think that's a common one that comes up. And so being able to kind of go back to the images to say, well, actually, in this area, this points to this, and this area points to this. Um, that's been quite helpful. And I think another example is, and one thing that you've mentioned before in like case studies, which was um, again finding the priorities, and if a lot of times if speech is the priority to then make the physio session more valuable and more worthwhile, then have that speech intensity first, get the recommendations from the team, and then kind of incorporate that into the physio sessions. I think that's been quite helpful as well, within prioritizing the treatment times between different disciplines.